How's everybody doing today? Good. Welcome to Lambeau. Well, good morning and welcome to our 2024 annual client workshop and HR summit. My name is Emily Trusk. I am the hospitality division manager here at 5G Benefits, and we are so excited to have you in attendance today. And we hope you walk away from this event with tons of new knowledge and ideas to implement back into your business. To get the day started, I just want to go over some quick housekeeping items. Anyone wearing a bright green lanyard is a 5G team member. If you need anything during the day today, please come find one of us. We'd all be happy to help you. Bathrooms can be found both inside this room, men over there, women over there, and then outside these doors as well. Refreshments including water, soda, and coffee will be available all day today right outside that room, which I'm sure everybody found already. Lunch will be served buffet style from 12 p.m. to 1 p.m. We have a private viewing suite located outside the room and down the hallway. Follow the signage and take a look. It's going to be right over there in that back corner by where lunch is going to be served. And we will be giving away some awesome trips to Door County this afternoon, but you have to be present to win, so please stick around. If my clicker would work. Anyway, at each of your tables on the centerpiece, you will see a QR code for those Door County properties, so definitely scan that and take a look. And then lastly, 5G Benefits has been approved as a SHRM recertification provider. This event qualifies for 3 SHRM credits. The activity ID will be provided at the end of today's presentation at 3:30 p.m. I would like to share a quick video to give you all a better idea of who we are as an agency and the benefits that we can bring to you and your group when you partner with us. I'm sorry, guys.
"5G Benefits is one of the most progressive agencies in the country. What's unique about us is that we're not a small agency, but we're also not a large agency. And all clients want is they want all the resources from a large agency, but they want the local support. We're right in the middle where we're able to be nimble and bring ideas that other agencies just aren't doing. They're not bringing savings. They're not bringing cutting edge ideas. They're not bringing education. Those are all the things that 5G Benefits does do to make sure that our clients are appreciated and have those tools to make their benefit package better.
Our goal is to make sure that our clients see savings and are taking care of their employees. So whatever we need to do from a quoting standpoint, a service standpoint, any value adds that we can do, that's our goal at the end of the day.
If you want somebody who's always going to put your interests first, give us a shot, because that's what we do. Like, we have no hidden agenda, very straightforward, and always trying to do the best thing for a client.
The reason that people want to work with 5G is because they're working with a company that's going to stay ahead of the curve, as well as think outside of the box to come up with something that's going to fit for them.
Our approach is more of a proactive versus reactive when we're looking at their individual needs versus just giving them a basic quote or policy off of what they think they need.
We also are very good at educating our clients, so we offer a number of different things throughout the year that can make sure that our clients are up to date with all the things happening in the industry. We host an annual client workshop at Lambeau Field, which is a one-day, all-day training at Lambeau. We do education, and then we have a keynote speaker. We like to keep our clients engaged.
I think something that we do that sets us apart from everyone else is to be able to provide that education piece where I'm able to go in and talk to the employees and explain their insurance policies and explain why it is really valuable.
Our goal at 5G Benefits is to bring ideas to employers that they've never seen before, that is going to allow them to stand out from their competition and really become that destination employer in their market. "5G Benefits is one of the most progressive."
Here is an awesome picture of our team. We have experienced a ton of growth over the last few years, and we now have 24 employees spread out between our different divisions and locations, and we are super excited about our continued growth. These three gentlemen make up our sales and advising team. If you aren't already a 5G client, make sure to find Tony, Rick, or Kyle today to discuss how we can help you revamp your benefits package and find your company massive savings. This is our support team and the girls that make everything come together. They are the backbone of our sales guys and handle the day-to-day support and service for our clients. Here is a quick overview of today's agenda. You can also find it on the front of your notepads in front of you at your table, as well as the 2 large poster boards displayed outside of this room. The speaker lineup for today is as follows. This morning, we will have Tony Gable, founder, CEO, and advisor at 5G Benefits, Beth Allen, ERISA attorney at Allen Law, Matt Ort, co-founder of Self Fund Health, Tia Vaccaro, nurse practitioner for Pivotal Health, and then in the afternoon, after lunch, we will have Chris Zarnick presenting on winning the war for talent, Tony Gable leading the HR roundtable, and then finally, George Kuntz, former Green Bay Packer. I would like to take a moment to recognize today's event sponsors. We wouldn't have been able to throw an event of this caliber without them. Pekin Insurance, Gable Insurance and Financial, Network Health, Robin Health Partners, Mutual of Omaha, Paylocity, Merit Financial Advisors, Prevea 360, Dean Health Plan, Colonial Life, Pivotal Health, Employee Benefits Corporation, and Delta Dental. Thank you. Then just a quick and friendly reminder that this seminar is not to be taken as legal, tax, or HR advice. Please always consult your legal counsel for your specific company-related questions or concerns. Now, finally, I would like to turn it over to our founder and CEO, Tony Gable. Tony started 5G Benefits to be the most innovative agency in the market and bring ideas to help Wisconsin businesses compete nationally. Tony is a top-of-the-table MDRT member, which is the top 0.01% of advisors in the world. He also won the EBA magazine's Rising Star in Advising, an award given to the nation's top advisors. As a company, 5G Benefits has grown from no clients and no carriers to now being on the prestigious Inc. 5000 list and one of the top family-owned benefits and insurance firms in Wisconsin. Help me welcome Tony to the stage.
All right. First, I gotta make sure this thing works today. There we go. All right. So normally start out when I do my talk is the point of why we do this is we really want to just get our clients together, get companies together, and for you guys to learn. And you're going to be taking a lot of notes. We want to start out the front end just a little bit about who we are as a company. But biggest thing we want you to do is have an open mind. There's going to be a lot of ideas, and as you start writing your notes, the thing I've said at previous things is write down 3. At the end of the day, you're going to have a lot of notes, but 3 things are the biggest takeaways. Try to implement those in your business, because if you start trying to do all these things at once, it starts becoming overwhelming. And try to keep track of that and do 3 things to implement through the business. And we're trying to hopefully get some content today. And the first part of the day is going to be a little more on that content. And then we have some really good speakers in the afternoon as well that are going to lighten it up and really provide some ideas on the overall business side of things. So one thing that I've always, my thing that I've always done is Tony's Top 10. So I have a list of kind of 10 things that are just straight to the point, things that we've seen that we're doing right now, talking to clients about, talking to companies about. The first one that we've got here is assistance, employee assistance. One of the biggest things out there for your employees are programs that can lower the cost of their health care or their medical claims, and they probably don't know that they qualify for them. So we have 4 types of assistance: insurance policy assistance, charity fund assistance, hospital with 501(r) mandates, and then prescription manufacturers. And I've heard this from our individual team as well that says this a lot on the Social Security planning side, is most of the problem is most of the local, state, and federal programs and agencies can't give advice, and they won't. So they're only going to give you advice on the questions that you ask. And the issue with that is that most people don't know what questions they ask, right? So when I'm talking about insurance policy assistance, I'm not talking about quoting your insurance policy. What I'm talking about is like, there are programs out there like the Badger Care. Wisconsin's got the Badger Care. You know, you've got the Affordable Care Act side of things. You know, like there's something called the Family Glitch that started. So if you've got you know, spouses that are on your plan that are not offered insurance, they can now qualify for the Affordable Care Act and get subsidies based on their you know, based on their age and geographic. So there's some things there. Badger Care, not paying enough of the premium. If you pay less than 80%, you might be disqualifying your employees to actually qualify for Badger Care. So, you know, health insurance is about who's on your plan and who you're paying for and who you're not paying for. So if there's programs out there that your employees are qualifying for that you're disqualifying them for, that's going to affect, you know, your overall strategy on what you're paying towards benefits. The second one is charity funds. This is a new thing that we've been doing I would say for some of our larger clients with more than probably 75 enrolled. Think of this when somebody has diagnosed with maybe a severe cancer or maybe a rare transplant need. There's actually charity fund assistants out there that want to donate to help those people you know, go through their needs. And when I say help those people, is we actually work with the company that tries to get that employee to qualify for charity fund assistance to cover all of their out-of-pocket and all their premium costs, and actually waive your insurance plan and take this charity funded program that gets them off your insurance plan. So what does that do to your plan? It now takes potentially the highest cost claimant off of your plan and allows your company to look completely different in the eyes of underwriting. So it's called charity fund assistance. There's programs out there that can actually do that, and we can you can talk to Rick, Kyle, and I on how that would work and what that would look like. Hospital side of things for assistance. The 501R mandates. Have anyone heard about that before? So when Affordable Care Act came out, they basically gave money to all these nonprofit hospitals. So there's 134 nonprofit hospitals in the state of Wisconsin alone. So what the 501R mandate says is that if you're a nonprofit hospital, you have to actually give free or discounted services to people that are lower income based on the federal poverty level. So what does that mean to your employees? If they qualify based on the federal poverty level, they might get free or discounted services at that hospital. So they could potentially have their claims forgiven, essentially. So your employees can just look at the hospital that they're using. There's, like I said, 134 hospitals in Wisconsin that are actually mandated by law to do this for your employees. It shows right on their websites, but nobody in this room hears about it because they're not actually talking to your employees about it. So this is an education piece of if you have people that are on that federal poverty level or lower, and you'll be surprised at who actually does qualify for this. They could actually get assistance on their actual claims at some of these nonprofit hospitals. And like I said, 134 in Wisconsin. Prescription manufacturers assistance. This has been a huge thing that we've been doing of prescriptions. You know, buying your prescriptions, sourcing them from internationally, manufacturers assistance, international assistance, working with the health plan. So even some of our, like Network Health here today, for example, they have something called Save on SP that's actually working specifically on specialty meds, that they have an in-house pharmacist that's going to work with your employees to try to get those prescriptions lower. So there's a lot more assistance programs out there that you might qualify for. So this is just a real short slide that I want to put on this. Is just part of the problem with healthcare in general is, you know, Wisconsin is actually the 4th highest in hospital costs in the country. That's a problem when it comes to healthcare. And the other problem that we're seeing is, you look at that Medicare versus workers' comp, you're going to start hearing about this more and more, is, for example, we had just had a large claim. And, for example, if my mom on Medicare walked into that hospital and had services at 8 a.m. for the same, you know, for a surgery, for example, that hospital might have accepted a $5,000 payment. Whereas if your employee came in there for an 11 o'clock appointment, they might be making $50,000. That's an issue for the exact same service at the exact same hospital with the same exact doctor. That is something that we're going to start really attacking, and especially if you're into that self-funded side, setting up what we're going to talk to you about is direct contracts and some other things about buying wholesale. So Medicare in general, just a real quick snippet on Medicare, and we have a whole Medicare team on the Gable Insurance side that's been out there. There's some major changes on Medicare that's actually coming. This is point number 2, is that, maybe you've heard of credible versus non-credible. So what does that actually mean? It basically means if your employees are on your insurance plan and they're eligible for Medicare, so let's say they're 65 or older, eligible for Medicare, or maybe they're disabled and on your plan, they're supposed to be, credible basically means that Medicare's benefits are going to be comparable, or they're actually, the out-of-pocket is $2,000. It used to be, there was no cap. Where's Bree? Yeah, she's in here somewhere. But there was no cap. It's actually going to be dropping down to only $2,000. So what that's going to do is Medicare's benefit for prescriptions are dramatically increasing for all the participants. So what that means is that all of the plans that potentially were credible before might now be non-credible. So at the end of the day, it's not the biggest deal of the world, but where it comes to a deal is that if somebody is on a non-credible plan and they're on your insurance, they should enroll in what's called senior care. It's only $30 a year where they can avoid a penalty, because what that means is that if they're on a non-credible plan, they need to enroll in senior care, otherwise they'll pay that penalty for the rest of their life, because that's where the non-credible and credible comes in. So if you ever are running into a situation where you have somebody 65 or older on your plan, maybe they're disabled, call 5G, call our Bree in our Medicare department, because there's a lot of complexities with Medicare, with like when's it primary versus secondary, and when does your Medicare cover and versus when does the health plan cover. Captives versus associations and consortiums or cooperatives. Is anyone on a captive or association or consortium? I know there was a couple people I was talking to before. There's been a lot of talk about them. What basically are they? You're kind of looping together a bunch of people onto one plan. A captive, for example, you actually own part of the stop loss and the actual captive, the carrier itself. So there could be some dividends and some lower premiums potentially for you. But the biggest thing is that we're seeing is just because you're on captives, associations, or consortiums, or even self-funded in general, that doesn't always mean that you're saving money. So it really comes down to the claims, and if you are the healthiest group in the world, you're probably not better off in a captive. You're actually probably better off doing something yourself and getting underwritten yourself. So it really depends, and that's why you have to be looking at all the options that are out there, if that makes sense to do that or not. Pay wholesaler instead of retail. I've been starting to say this quite a bit more. Who's got a Costco membership? A lot of people in the room have a Costco. Why do you have a Costco membership? Because you're paying wholesale, right? You're paying wholesale for your goods and services at Costco. Nobody does that on medical claims. Like I was just saying with workers, with Medicare, and the next person is 10 times as much on a private insurance plan. Nobody's doing that on medical. So the whole notion of how can we buy wholesale on medical claims versus paying full retail whenever your employees are coming in. So we have a couple speakers later that are going to talk through how maybe you can do that. It's direct primary care, actually partnering with hospital systems or partnering with providers directly. We've said it many times as, why do you need a national network if all of your employees are located within 20 miles of one location? Right? Partner with the pharmacy there. Partner with the hospital there, partner with the provider there, and pay wholesale instead of retail. Okay, so it's a mindset of how you're buying your actual health care, and you're buying a little bit different. Real-time intercept, this is another thing that has been a big game changer in how we're positioning your health plan. We were talking to a company with about 500 employees. They were doing everything right, everything right. They were doing incentives, and they were doing direct, like I just said, they were doing some wholesale stuff, and they would have partnerships with all these clinics that are low cost to try to save some money, but nobody was using it. Nobody was doing it. Why? Because there's just no way for them to make it easy to do that. So when, for example, my wife needed an ultrasound a couple months ago. Okay, she needed an ultrasound, and her doctor was like, "Oh, just go upstairs and go get that ultrasound done." And my first thing I said was, how much is it going to cost, right? And it was going to be a couple $1,000s for the simple ultrasound. Whereas like real-time intercept, is basically it's saying, hey, it looks like we just saw an order for an ultrasound. Let's actually send you over to this one that your employer has a partnership at this ultrasound clinic. And if you do that, we're actually going to give you $150 to get it there versus this other one. Oh, and the ultrasound's only $150 at this place instead of over here. So actually a proactive, reach out, or if we don't have it on a plan that's built in like that, we can at least try to steer to that. But what that's going to do, that's going to dramatically lower the cost of your healthcare, because they're using lower cost providers over higher cost providers. Okay, compliance checkup. We've always assisted clients with compliance, but when the Consolidated Appropriations Act came through, and we have an ERISA attorney we flew in from Texas to talk specifically on compliance today, because it's changed a lot. We have what's called our compliance packet. It went from 60 pages to nearly 100 pages just from that one law. And we really think that that's a big compliance issue for a lot of employers. Because a lot of times what happens is employers have people that are not full-time HR people managing HR and compliance, right? And it's just the reality, right? There's small businesses that have a lot of hats. So we've got to figure out a way of how can we proactively do an audit and a reach out on the front end to make sure you are in compliance with all these new laws and regulations. So we have these compliance checkups that we're starting to do. Clients, you'll have access and you'll start seeing those very shortly here. Invested HSA. I've talked about this every year. I want to continue to reinforce this invested HSA thing. Raise your hands again. How many people have an HSA? A lot, right? A lot of people are doing HSA plans. They're not new, but what is kind of new still is these invested HSA sides, where instead of having everything at a bank, where you're not, really getting any interest, it's like 0.01% interest that you're getting on your money. You can actually do an invested HSA where there's a banking side still, where you get a debit card, but then there's also another side where you can actually get invested on based on how conservative or aggressive you want to get. And where it really starts to change for you personally is if you do have claims and you can afford to do this, even if it's a $1,000 claim, for example, since you're investing that money grows. It goes in tax-free, it grows tax-free, and it comes out tax-free if you're using it for qualified medical expenses, right? So if you're investing it and it's growing, you're earning even 8%, 9% a year, look at that over a 20-year curve, and it's going to be significant gains that you're going to have in this HSA. So you could actually not use your HSA to pay for funds, hold on to receipts, and reimburse yourself in the future. There's no time frame of when you have to actually reimburse yourself from the HSA. I want to continue to reinforce that because that is probably the biggest loophole of any investment out there is the invested HSA option. Last few things, estate planning and business planning. There is a large thing changing on this side of things is the gifting has always been $18,000. So this is really for people that are looking for long-term assistance on the value of your estate. But the estate tax exemption is actually getting pretty much cut in half by the end of 2025. So what that means is that a lot more people that have businesses and at large assets are going to be in an estate tax issue. I mean, this could be a significant burden if you were to pass away. And look at the value of your companies. I mean, some of the values of these companies have skyrocketed of private businesses as well. Real estate has gone up. So if you have a lot of real estate holdings, that's the same thing. That's the value of what you own is probably worth a lot more. So doing some estate planning over the next year is going to be critical if you have a large estate. So gifting, you actually can gift. It's kind of like an HSA. It's if you don't use it, you don't do your HSA contribution in that year, you lose it. That's the same thing with this gifting, this $18,000 annual gifting that you could do. So we're working with a number of companies on how to actually gift either some of the values of their shares or even gifting towards the value of a life insurance that's actually going to pay for the estate tax and using like a second to die policy or key man policies on key people in the company. So the main point I want to put there is things are changing dramatically on the estate tax You need to do something about it if you have a larger estate. Mental health. We've probably heard this many, many times, since COVID, that mental health is becoming worse. And it's a serious problem nationwide. I have a question is, who in this room wants to increase the value of their company, increase the sales of their company, and increase their individual income? Like, who wants to make more money over time? Everybody. Everyone's hands are up. Now, who wants to increase their income, the value of their company, and their sales at the detriment of your mental health or your employees? Nobody. Right? So what does that tell you? Is that you don't have to be perfect. You don't have to be perfect as a company. Sales is not more important than your mental health or the mental health of your employees. And that's critical. When you talk about mental health in general, everyone's like, well, let's just add an EAP program, an employee assistance program. No, it starts way before that. It starts about having realistic expectations of your employees. It's about having appreciation, having good culture. It's about having way before all of that, right? So I think I want to challenge everyone in the room, and we've got great speakers this afternoon to talk about that specifically. And it's really about going back to the basics, right? People didn't see people for how long? Let's get back to that, right? And let's get back to just, not having too high of expectations on vendors, our employees, on anybody, and just working as a team, working as a partnership, when it comes to, everyone together as business. Last point, remember your DBCs. This is a term that I've come up with. It's just called, remember your DBCs. It's not ABCs, it's DBCs. Don't be cheap. And, I can sit down in a meeting with companies and tell within, 5 minutes, what they believe in, if benefits is of value to them to keep their employees and attract employees or not. Like, we can tell, Kyle and Rick we can tell in 5 minutes, what an employer's mindset is. It's a mindset of what do you want to do for your employees. The best investment you can make is into your employees, like, period. The best investment you can. And, benefits is a huge tool for you to do that. And it's, like I said, it's a mindset. You can go from paying the bare minimum to having a full benefit package that's going to be making people excited, and that also, helps with number 9 there. And that's the whole point of what we're trying to do. We're all trying to grow our business, but once again, we're not trying to do it at the detriment of our health or our employees' mental health, right? And that's what we're trying to do today and get you guys ideas. Okay, so that was kind of my main thing that I want to go to. We've got a huge, speaker coming up next. Her name is Beth Allen. At this time, I want to introduce Beth Allen. Beth is an ERISA attorney at Allen Benefits Law, who is a new compliance partner for 5G Benefits. She actually flew in today from Texas. She advises employers, plan sponsors, and benefits professionals on the legal obligations imposed by federal, state, benefit-related laws. She started her career as an investigator for the Dallas Regional Office of the DOL, Department of Labor, Employee Benefits Security Administration, and worked as a benefits consultant, compliance counsel at an international brokerage for several years. She enjoys helping professionals make sense of all the regulations and litigation surrounding employee benefits. Let's welcome Beth.
Thank you. I'm going to come over here. Thank you. Good morning, everybody. All right, so Tony and the team decided to start with compliance today. So we're going to start by waking everybody up a little bit. I'm Beth Allen from Texas. So I flew in here yesterday from DFW. When I left, it was about 85 degrees. And I came here and was reminded that it's actually, I think, technically still spring, right? But not where I'm from. I'm happy to be here, and thank you to Tony and the team for inviting me out. I love to get in front of groups like this and talk about compliance, because if I'm not doing things like this, then I'm basically kind of scouring through legislation and things from the DOL and things from the IRS, and obviously things like this are a lot more fun. So we're going to start off, I want to kind of learn a little bit about you, okay? So can you raise your hand for me if you are an under 100 participant plan or employer? Oh, that's a bunch of you, okay. How about under 500, but above 100, okay? Anybody above 500? Okay, how many of you offer a self-funded or level-funded plan? Okay, that's a bunch of you. And everybody else has a fully insured plan? right? Yeah? Okay, and then as far as the people who are here, how many of you are HR staff? Do we have any CEOs or CFOs, executives? Oh, we got a few, so that's good. Welcome. So we're going to talk today about basically health and welfare and the enforcement of health and welfare plans under ERISA, okay? Now, I will start off by telling you that really, if you've been in this business for a long time, anybody been in this for over 20 years? So we kind of were very concerned about retirement, right? And we had years and years of understanding what it takes to be compliant on the retirement side. But that health and welfare side, you kind of just paid your insurance premiums for years, right? And really there was no question about, okay, what does it take to be compliant? And frankly, that's kind of the government's fault, and I'll talk about that a little bit and why. But we're going to talk about enforcement of health and welfare plans first. And then we're going to go into kind of what the compliance obligations are for health and welfare plans. And then we're going to end out just talking about the idea of health and welfare plan governance, which is an interesting term. I think on the retirement side, you would be familiar with the idea of plan governance. How many of you have like a retirement committee that decides on kind of investments and things under the plan? How many of you have that same committee on the health and welfare side? So not as many, right? So we're going to end out the conversation talking about that. So I want to start off talking about health and welfare enforcement. And I always like to go through the history because I think it's really interesting to kind of bring up and let you know how we got to the place where we're at in 2024, okay? So ERISA started in 1974. Who can tell me what the R stands for in ERISA? Anybody? Retirement, okay? When the law started, it was focused on retirement. And was anybody around in 1974? Do you know what your retirement plan was in 1974? It was a defined benefit plan or a pension. How many of you actually have a pension right now? Yeah, very few, because they're dinosaurs, right? We don't even have those anymore. But when the law started, that is what it was about, okay? In 1978, we see kind of this change between the DOL and the IRS because they both had joint authority over ERISA, but they hadn't really worked out like who does what, okay? And so in 1978, we see them make an agreement to say, okay, DOL, you are responsible for the idea of being a fiduciary, right? Which is this idea that employers are making decisions on behalf of their participants that need to be good decisions, right? And then the IRS is concerned with taxes, money. Somebody said money over there, right? And so when we think about the idea of the qualification of your plan and whether or not you're making the right decisions from a tax standpoint, that's what the IRS is worried about, okay? And I bring that up just to kind of tell you that the rest of this conversation is going to really focus on ERISA and the DOL and what they do. And so keep in mind that we're specifically dealing with kind of your fiduciary duties under ERISA. And then basically we see like this long gap as it pertains to health plans. And then in 1985, we get COBRA, right? So COBRA is actually kind of the first specifically health and welfare requirement that we get under ERISA. And at this point, everybody has been doing COBRA for years, right? So we've been doing continuation coverage for people who are terminated or have their hours reduced. And that was kind of the first big law we saw. And then after that, a long period of time goes by. The mid-90s, we start to get laws about kind of all these random things that Congress is trying to protect. So we see HIPAA come out, both the portability and the privacy and security requirements. We see basically mental health parity. We see the Women's Health and Cancer Rights Act. Really, Congress was like looking at very specific problems and amending ERISA to address those, okay? And that's really all we got from about 1996 to 2008. And then in 2010, as Tony mentioned, the ACA passed. And that's actually when the DOL started enforcing ERISA on health and welfare plans the most. I joined the DOL in 2009, and at the time, I did about 90% of retirement enforcement and 10% of health and welfare. And really that 10% of health and welfare was only because the older, more seasoned DOL employees didn't actually want to do health and welfare, okay? By the time I left, that was probably a 50-50 split, and I left in 2014, and now they're also doing probably about a 50-50 split on retirement versus health and welfare enforcement. So when we talk about the DOL, the Employee Benefit Security Administration is the group that basically has jurisdiction over the fiduciary aspects of ERISA. Has anybody had a DOL investigation of either their retirement or their health and welfare plan? Anybody even had them reach out to you? So you've been somewhat lucky, right? And part of it is because you all roll up to the Chicago regional office, and as you can imagine, the Chicago regional office has a lot of very large employers, and generally because they're working on your tax dollars, they really need to get kind of the biggest bang for their buck, so they figure, okay, if we go after larger employers, chances are that any corrections that we find are going to affect more people. Now, you can always get a complaint though, right? Like your participants can always call the DOL and make a complaint about anything you do. So I always tell smaller employers like, hey, you still have to stay on your toes because you still have the risk of the DOL coming out and dealing with your business. When we consider some of the current DOL health and welfare priorities, Tony mentioned a couple of them, right? So mental health parity is a big one, right? And mental health parity is a law. The first iteration of it that we saw was back in the late 90s. The most recent iteration that we saw was from the ACA, but COVID hit us really hard, right? In that we realized kind of as a society, I think, that mental health is a big deal and that employers really need to provide offerings that help people deal with their mental health. And so as a part of that, we had both state and federal legislation that said, okay, we need to make sure that you're complying with the MPIA, which is the idea that if you offer mental health, you have to offer it at the same level as you offer basically health, medical surgical coverage, okay? So the idea would be that like, okay, if you have $50 copays for your medical surgical coverage, you shouldn't have a $100 copay for your mental health coverage. The idea being there that you're instituting kind of a harsher barrier to getting that mental health care. So that's one that they're really focused on. The No Surprises Act is a piece that is interesting, but it currently kind of involves both federal and state law, where the requirement is that you can't have like this surprise bill, right? So like the example that a lot of us probably will be familiar with is a woman who goes into a hospital to give birth to a baby. She thinks it's all covered with the hospital and what the hospital has laid out. And then months later, she gets a bill from the anesthesiologist who says, I was out of network. And that's obviously a problem, right? And so both state law and federal law has addressed that, but the DOL is still getting complaints about people being balance bills in situations where they should not be, okay? Life insurance is an interesting one, right? I'm gonna talk mostly about medical, your major medical coverage, but we're finding a lot of problems with life insurance in that employers are not necessarily paying attention to the requirements that the life insurance insurer is actually imposing, right? And so you might have a life insurance provider who often says, if you don't come on the plan immediately, then you have to do evidence of insurability if you come on later, right? But you have employers who are potentially having someone who will come in during open enrollment, enroll in life insurance, doesn't ever do the evidence of insurability requirements, but the employer has been taking money out of their check for life insurance that they don't have. And then someone dies, and then they don't have life insurance. So as you can imagine, the DOL is really invested in that. And then finally, I mentioned that the DOL always takes complaints, right? And when I say complaints, I mean like participants can call, you can call, whistleblowers can call, service providers can call, anyone can call the DOL and basically make a complaint against an employer. The one point I will make about that is that the people who take those complaints are called benefits advisors. And they deal specifically with the complaint they received. So if someone calls in and says, hey, I have this employer, they did not provide me my SPD, then that benefits advisor is gonna call you. And they're gonna say, hey, this person is saying they didn't get their SPD from you. Did you give it to them, right? Now, you might have given it to them, but you cannot ignore that benefits advisor's call, right? You have to say, yes, I gave it to them. You probably have to give them the actual SPD, because if not, if you tell them to kick rocks or ignore them, then they're gonna send you to the investigator side of the house, where investigators are gonna review your entire plan, right? So we want to deal with benefits advisors if you ever have to, and just kind of do whatever they need you to do so they can close out their case. Now, we're gonna talk a bit about health and welfare compliance. And I hope y'all are listening and are gonna have questions at the end. I'm leaving about 5 to 8 minutes of questions. And if you don't ask questions, then I'm gonna have to tell you stuff that I think is interesting that may not be interesting to you, okay? So please be thinking about questions. With health and welfare requirements, it's a lot of the same requirements that actually apply on the retirement side. And so we're gonna go through each of these, and I'm gonna talk about some of the pointers that I give to employer plan sponsors as it pertains to complying with ERISA, okay? So we're gonna talk about basically disclosing routinely. We're gonna talk about minding your plan assets. We're gonna talk about the incorporated laws like the COBRA, the MPIA, and things like that. And then we're gonna talk about basically fiduciary duty, which is your obligation to act prudently and make decisions that are in the best interest of the plan. And so starting off, one of the biggest things that the DOL looks at if they ever review your plan is the disclosures that you're making to plan participants, okay? There are a number of them, right? Now, most of you who work with, let's say, a broker like 5G, they will give you, let's say, a packet of notices that you're supposed to provide at open enrollment, right? And that kind of meets sort of your annual requirements to provide those notices. But there are a number of documents that are also required to be given, right? And so we have a plan document usually, we have a summary plan description. I will say that on the health and welfare side, generally, there is just a summary plan description, Or there is not that either. There is just, let's say, an insurance certificate, right? And if that is all you have is the insurance certificate or whatever booklet that you got from your TPA, you do need to have additional documentation that actually makes that rise to the level of being a summary plan description, okay? And then we have summary and material modifications, which is when you make a change to the benefits, as well as a summary annual report for those of you who have to file a Form 5500, okay? Some required notices that the DOL looks out for are things like the CHIP notice, right? And that's an annual notice that basically tells people that if you have a child that is eligible for Medicaid or CHIP, that potentially they can either get funds from the state to stay on your plan, or they could potentially go onto the Medicaid plan and get that service provided potentially for no cost, okay? So that notice is kind of important. The COBRA notices I always bring up, because COBRA, although a lot of employers are using vendors, you always have the responsibility to monitor those vendors, right? And what we'll find sometimes is even when an employer has a vendor, because of human or maybe computer error sometimes, things will end up where like months go by and nobody gets a COBRA election notice, right? And so the DOL is going to look for that because obviously if somebody calls them saying they didn't get COBRA, they needed it, right? And it's going to be a big deal. The notice of exchange is also kind of an interesting notice because it tells people that if they're not eligible for coverage under your plan, that they can go to the state exchange to get coverage. And then finally, if any of you have a wellness program, and so a wellness program can be a number of things. It can be you have people fill out a health risk assessment. It can be that you impose a tobacco surcharge. It can be a number of different things that are aimed at wellness. And if you do any of those things, then there are notices that are required. Now, when we talk about disclosing, one of the things that I always mention is that the DOL is very specific about the rules that are imposed on how you disclose those notices, okay? Now, I'm gonna be realistic. We all have computers in our pocket, right? And so we are an increasingly technological society where we get everything. I mean, we sign documents on by electronic means. There's a lot of things that you just no longer do on paper at all, right? However, when the DOL is looking at whether or not you actually distributed a document, they're concerned with actual receipt of it. So their concept there is that you basically need to make sure, if you are basically giving things to people electronically, that the way you are doing it complies with their rules, okay? So the rules kind of look at two different groups. The first group are people who basically work at computers all day. And when I say work at computers all day, I mean they work at computers all day. I don't mean that they check in on a computer as a kiosk. I don't mean that they have a company email. I mean that they work at computers all day, okay? And if they work at computers all day, you can give them things electronically. The second group doesn't work at computers all day, right? So people who do construction work, maybe even, retail salespeople, maybe even restaurant, hostesses or restaurant servers are not working at computers all day. And that group, you actually have to get their consent to give them things electronically, okay? Now, once they've given their consent, and for that first group who you can give things electronically to, then basically you have to also give it to them in a way that they know they got it, right? A lot of employers use like a portal. How many of you have like a portal where you will upload documents for employees? Right. So if I put something on the portal, but I don't tell you I did that, do you know that you got it? Right. So the DOL rules are going to say, okay, well, you put that on a portal. You need to send that person an email that says, hey, we put this on the portal, this is what it is, why it's important, and if you want a paper copy, you can ask us, right? Now, how many of y'all are doing something like that right now? Okay, a few of you, very good, okay? But I'm gonna be honest, like the DOL, if they're gonna come out and say, well, did you give out this notice? If you didn't kind of meet that requirement for the electronic disclosure, then they consider that you didn't give out the notice. All right, so let's you can kind of work with the 5G team, I'm sure, to kind of shore up your processes there, but you wanna make sure that you do that. As far as the 5500 requirement, now how many of you said you were 100 or over? So you're filing a Form 5500 annually. This is just kind of one of those things you have to do if you offer a plan. You're all doing it on the retirement side if you offer retirement plans, right? But on the health and welfare plan, it's also required. One thing I mentioned here is that if you have a plan where you offer, let's say, a life insurance benefit and a medical benefit and dental, and you kind of wrap all those together, you really want to look at the benefit with the highest number of people, because a lot of employers think of it from the standpoint of, oh, do I have 100 people on the major medical? But let's say that they allow their part-time people to have basic life insurance. Well, if you have over 100 employees who are receiving that basic life, then you're also subject to the 5500 requirement, and a lot of employers don't necessarily recognize that, okay? Now, this next one I said, mind your plan assets. I grew up with great-grandparents, and my great-grandmother always told me to mind my pocketbook, which might be a Southern phrase. Y'all might say mind your wallet, or I don't know how you say it in the Midwest. But the idea is that you have to kind of watch out for your wallet and your things. And so kind of my point here is that when we think about plan assets, we think about the retirement plan, right? People have that millions of dollars, actually trillions of dollars in their retirement accounts, and we think about those as plan assets, but we hardly ever think about the money that is paid through a health and welfare plan to be a plan asset. But ERISA looks at them the same, okay? And so there are some rules there with your insurance premiums. Those need to be paid within 90 days. I'm sure all of you pay them within 90 days so that the insurance doesn't get cut off, right? But obviously, if you don't pay those premiums, then that becomes a problem for the DOL. HSA contributions are actually treated similarly to 401k contributions in that they need to be sent to the HSA trustee as soon as possible, basically, right? There's no time that you have to basically put that money over there, but you need to be doing that as well. And then as far as health and welfare plans, none of you probably have a trust, right, because of the size of employers that we have here, but that requires different requirements. And then those of you who might receive medical loss ratio rebates, there's generally rules about what you can do with that, especially if the participants are also contributing to the coverage, okay? So you want to make sure that you understand those rules as well. One of the things that I always mention when it comes to health and welfare plans is under no circumstance should somebody pay more than the cost of coverage. And that sounds like it's like common sense, but I get a number of questions every year around renewal where an employer will say, hey, we have this voluntary dental vision, meaning the employees pay 100%, and the cost went down. Can we just keep the cost at what they were so that we don't have to adjust things? No, because that's stealing, right? Like if you are being charged a premium to someone, for someone, then that is the most you can charge them, right? It gets a little bit more nuanced when we start to think about self-funded plans, for example, because you might be coming up with a premium equivalent, and I'll see a lot of employers who are like, oh yeah, with the premium equivalent, we add in, let's say, a maximum liability amount that's just an extra 20% to make sure things stay good. And that's also, you have to be very careful with that, right? Because unless that extra 20% is going to be paid by just the employer, you're kind of charging people more money than you should, right? And so we want to think about those things when it comes to plan assets. When we talk about incorporated laws, these are the ones that, like I said, the DOL is pretty focused on. COBRA, I always bring up the fact that if someone is willing to pay 102% of the cost of coverage that they might have been only paying, let's say, 30 or 40% of before they were terminated, then they need that coverage, right? And so if you mess up on it, it becomes a big issue where the DOL is going to take issue and you may very well get sued as well, okay? Mental health parity, again, that's something where, a lot of employers did not design the mental health limitations that are imposed on a plan, but you are going to be held responsible for them, right? And so you're going to want to work with your insurer or your TPA to make sure that you understand how MAPIA applies to your plan and kind of what might need to be done as the law is changing. As far as HIPAA, HIPAA is both a portability law and a privacy and security law. So on the portability side, we got this requirement that you can't discriminate against people based on a health factor, right? You might be saying, well, how does that come up, Beth? If those of you who might be self-funded or even fully insured are like, oh man, we had a really high renewal rate, and we know that we have this one person who is receiving like this really expensive infusion, let's see if we can, recommend that they go to the marketplace. That's going to violate HIPAA because you are basically taking their health factor and saying, we're going to make a decision about your coverage based on your health factor and the way that it's kind of costing our plan. Now, there's ways to kind of design your plan and to make changes that the 5G team will help you with when you have those high claimants, but you want to be very careful that you are not making specific decisions about specific people with high claims because you're likely violating HIPAA, okay? And then on the privacy and security side, my health information is private, right? And employers should keep it that way and make sure that they're relying on those rules or doing what they should. A few other things, qualified medical child support orders. Those are when you receive basically a child support order from a court or a state that tells you to enroll the child because the parent likely did not enroll them when they were supposed to, frankly. You want to make sure that you're dealing with those promptly and enrolling children. And then lastly, Tony mentioned the CAA and the transparency and coverage rules. We got a number of requirements that for those of you who are fully insured, sure, maybe less so for self-funded, but maybe not, where there's a reporting requirement, right? So we're all gearing up for the RxDC reporting, right? So that's like the prescription drug cost reporting that your insurer might have asked you for information on to help you fill out. And then there's other types of like public data that has to be available. And you want to make sure basically that your TPA is helping you meet those requirements. And then finally, the idea of basically making decisions responsibly or acting as a fiduciary. The requirements that we get from ERISA are that you act solely in the best interest of participants and beneficiaries. Basically, kind of the way that we see the regulations talk about this, it's like having this eye singular to just the plan participants and beneficiaries. Now, the employer also has kind of their own, aims for doing things and for offering benefits, but the important point of ERISA is that that should take a backseat to basically what's going to be best for the participants and beneficiaries. It also has the requirement to act prudently. And the standard here is actually super high because it's not just the idea of being prudent, but it's the idea of kind of making decisions that an expert would make. And frankly, none of you are experts in like fiduciarying, right? Like you sell widgets is what we would say in law school, or you provide some kind of consulting service. But the idea there is that you would hire service providers that would help you to meet that standard of being prudent. And then also paying only reasonable and necessary expenses from the plan, as well as following the plan terms, okay? Now, the one thing I'd like to point out with fiduciary responsibility is you never get rid of it. And I think that the industry has somewhat done a disservice on the health and welfare side, because a lot of employers might tell you, oh, well, we have an insured plan. The insurer is a fiduciary, right? And they're a claims fiduciary, but there's a lot of decisions that you make that are not claims decisions, right? And so an employer never stops being a fiduciary for their health and welfare or retirement plan. It's always going to be your job to even make sure that you are monitoring the service provider as well. And then also, honestly, like just general awareness is a good thing. I will say that like as a DOL investigator, I either went out to companies where I asked them questions they had no idea about anything, or they were super knowledgeable, right? Now, you can very well be in the middle. Okay, I don't expect you to kind of like know everything that I know about ERISA and complying with these laws, but you also don't want to like know nothing, okay? Because it just doesn't look good and it doesn't look like you're meeting your fiduciary obligations. And then I also say you want to prepare as if you could have an audit on your doorstep tomorrow, right? So you don't want to have to wait until the DOL contacts you to get a lot of these things into place, because then you're on their timeline versus being on yours. Now, let's talk about health and welfare plan governance. And I think it's kind of interesting because a lot of people are like, okay, well, we've just been paying, again, our insurance premiums. We've been, working with our broker to go through with renewal and kind of make the new decisions and offering those benefits, but why should we also be basically making sure that there is like this governance process for health and welfare plans? And really, right now there's a lot of kind of public sentiment about how much health plans cost, right? And part of the CAA is to provide more information to people about the costs of their insurance in the hopes that it'll make kind of a more transparent situation and drive up competition to bring costs down, right? And so part of that, people are just getting more information. But the more information you get, the more knowledgeable you should be, right? And you should be making decisions based on that information you get, okay? Because of that, the government is also enforcing this, right, and enforcing more of health and welfare plans. We're also seeing litigation on this a lot more than we saw in the past. Those of you on kind of who are maybe nerds like me have followed maybe over the last 20 years that there's been a lot of litigation on the retirement side having to do with excessive fees, right? And plaintiffs' attorneys who frankly sue a bunch of retirement plan sponsors saying, hey, you made the plan pay too much because you didn't make good fiduciary decisions. Well, we're starting to see litigation like that on the health and welfare side as well, which is interesting because, like I said, we don't necessarily think of health and welfare decisions as fiduciary decisions the same way we do on the retirement side. But the plaintiffs' attorneys are starting to kind of gear that up, so you want to be careful, okay? The good thing about governance is that it provides some protection to an employer, right? Because again, a majority of you were HR employees, and you're making decisions every day that would likely be considered fiduciary decisions. So you want to make sure that you're also like protecting yourself, because ERISA is going to look at you as individually liable if something goes wrong, okay? And then finally, treating health and welfare similarly to retirement is going to be probably a best case scenario for you. So if you're doing a bunch on the retirement side and can't really point to what you're doing at all on the health and welfare side, that's kind of an imbalance that we want to fix. Now, what are my suggestions there? First, I would suggest that you have a health and welfare plan committee. Now, those of you who are small, you don't have enough people probably to have a health and welfare committee, right? And so I'm not saying that this is a good fit for everyone. But those of you who are a little bit larger, those of you who, for your self-funded plan, are maybe making a large number of decisions, having a committee makes sure that the fiduciary burden and the fiduciary title doesn't just fall on one person, right? When you have a group of people who are making those decisions, then it kind of spreads that burden out a little bit, and it also helps you to kind of take different backgrounds from different people that provide different perspectives as you're making decisions on the plan. As far as the concept of reviewing plan fees and expenses, this is kind of interesting because I think, again, on the retirement side, we look at fees, we look at 12B1 fees and record-keeping fees and kind of all these fees that are frankly coming out of people's retirement. And we think about that totally different than we think about, let's say, the fees that are paid on the health and welfare side, and that may even be worked into the premium that people are paying, right? But you also want to make sure that you're reviewing kind of the fees that are paid under the health and welfare plan, as well as kind of receiving what's called a 408B2 notice. This is a requirement we got from the CAA as well. It says that all of your service providers who make $1,000 off of your plan or more have to give you a notice that tells you their indirect and direct compensation. Has anybody gotten the notice or know what it looks like? Okay, so a couple. You want to make sure you get those from all your service providers and at least keep them, right? The DOL has not started enforcing that requirement yet, but I assume that they will very soon. And so that's something where they may just ask you, hey, where are your 482 service provider notices? And you want to know what that is and be able to provide it, okay? And then lastly, you want to maintain some oversight of service providers. Now, again, you are engaging them because they are experts, at least definitely more than you are a potential expert. But if you kind of just turn them over to kind of do their thing and don't actually know what they're doing, or if they're even kind of doing what they said they would do, right, for the compensation that they're receiving, then that puts you at a tough position, okay? So you want to make sure that you're at least checking, to see what they're doing. I gave COBRA as an example where you all have a COBRA vendor, likely, but are you checking at least once a year to make sure that the people who are terminated actually lines up with the people who got an election notice, right? It's things that are as simple as that to make sure that you are actually looking over what your service providers are doing, okay? I think I'm right on 30 minutes, is that right? Very good. Let's do some questions. Don't be shy. Yes?
If you offer a health insurance plan to your employees, you have to, are they forced to join your plan if they don't have any other options and they don't have a spouse or something?
So the question was, do your employees have to join your health and welfare plan? The answer is no. Generally, they do not. Now, there's some kind of state law kind of weird things, and so in the state of New York, for example, if you offer free coverage to employees where they don't pay anything, then the state of New York requires that they be enrolled in your plan, but Wisconsin doesn't have anything like that. And generally, if you offer your plan on a pre-tax basis, meaning that the amount that people pay is pre-tax, then you have to give them a choice to take the benefits or not, okay? And they don't have to prove to you that they have other coverage. A lot of employers are worried about that because of the employer mandate and the concept that, like, oh, if you go to the exchange, you get a premium tax credit, then you may not actually be eligible for it if I offered you affordable coverage. But the important thing there is that if they go on the exchange and they weren't eligible for it, then that's kind of between them and the government. As long as you offered them affordable coverage, you're good. Yes?
I was just wondering with the disclosures, like how is that 100 people defined and how do they define language requirements if you run multiple languages in your plant or in your business? How do they define the languages that you should inform people of, as well as the 100 people definition?
Sure. All right. So the hard thing about all the rules that we have is the definition of 100 people can change depending on what law you're dealing with, okay? And when we talk about 100 people for purposes of the Form 5500, that's 100 participants on the plan, okay? When we talk about, let's say, 100 people for let's say the Medicare disability requirement, that's actually belly buttons, so that's how many people work for you. The rules get very granular depending on what it is, right? What was the second part of your question on disclosures? Languages, thank you. All right, so really the only requirement on languages has to do with the SPD, the summary plan description. And what it says is that if you have employees who 10% or more of them speak the same non-English language, then you need to provide them a statement that says in their language, you can come to us to ask for these documents in your language, okay? Now, how we figure out if you have that 10% or more of people who speak that language is that I think CMS has what's called a class list that tells you based on where you are, for example, Wisconsin, whether or not your zip codes basically have more than 10% of a certain type of speaker. For the vast majority of the US, that 10% or more is potentially Spanish, right? But depending on where you are, for example, Oklahoma has a large Native population. They have some Native languages that have to be recognized. But the requirement there is really just to put in the SPD the note that they can ask for the documents in a different language, okay? We also see with the summary of benefits and coverage that there's kind of some information there that can be in different languages and things like that, but there's no overarching requirement to provide all of your documents in different languages. Now, if you're an employer who you know you have a large population of people who speak another language, it's also a good idea if you can translate it to go ahead and translate it so that they can read it in their own language, right? It's hard for somebody to say, I received a notice from you, if I know that I got it in a language I don't, speak, right? So that's a good question. What about this side of the room? Anybody? No? All right. Are we on time? Oh, 5 more minutes. Okay, the question I get a lot is, okay, Beth, well, how do people get picked by the DOL for investigation? And the number one reason is still kind of complaints. I mentioned that. It's a big deal. But then there's also projects that the national and the regional office will do, right? So for example, the national office has very long had a project on employee stock ownership plan. Are any of your companies owned by an employee stock ownership plan? Anybody? Okay. They've had a long project on that. In Texas, the region that's there, based on kind of some of the industries that were big there, we always had an oil and gas project because we had a whole lot of oil and gas companies, right? And so there are different reasons that, the DOL would have different projects. They also review your Form 5500s, so they will review years of them, and they review it kind of all the way down. And that can also give them some red flags, as well as certain issues that could even be in the news, right? So like if you start to have an insolvency issue, right, or if there's some complaint to the wage and hour group because you're not paying wages, then the idea is also that you're potentially not paying what you should pay under the plan, so they might come after you after that, over that. And so that's kind of how, employers might be picked. Anybody have one last question?
I have something that will bring up.
Oh, there's one right here.
Go ahead, and then after them, I got.
And we're good. Mm-hmm. Okay, so she says she's an engineering firm, and basically she sends out a lot of her things digitally, but she also has a paper copy binder that people can come and access if they want to come into the office. And she's asking if that meets the requirements under the DOL's electronic disclosure rule. When you're sending those things electronically, you still have to make sure you're telling them it's there. So depending on, if you email it, that's kind of the easiest way, because in the email you can say, hey, here's the document I'm providing you. You can come and access a paper copy, so that works. And if you're doing that for all your employees, that's kind of how you would want to do it, right? Now, again, those people who are working, let's say, out in the field or whatever, they should have given their consent to receive anything electronically. What I recommend, if you know that we never did a consent process, is just at the next open enrollment, like as part of the benefit admin or whatever enrollment process you do, ask them, do you consent to receiving documents electronically? You get them to fill that out, and then you've met that requirement. We good?
Yeah, real quick is, I know like Tony stopped on, I talked about the compliance checkup.
Sure.
Can you just explain, because I know a lot of people are probably like, okay, how do I know what I actually do need to do and not do?
Sure.
You went over a lot of stuff.
Sure.
Do you want to talk through just that side of things?
Yeah, so a compliance checkup is really good because, a lot of people come to these type of things and they learn a number of things and they write down notes, and I've seen you all being studious about this. But really, when it comes to reviewing your own plan, it's good when you can sit with someone like me and have me go through kind of some of the top things that plans need to be worried about, right? And so as part of the compliance checkup process that Tony mentioned, myself and some of the other consultants at BCS will be available for employers who would like to go through their plan and kind of look at 10 of the highest kind of large problem issues that we find with employer plans. And it just gives you an idea or a snapshot really of how you're doing with compliance. Sometimes it can open up Pandora's box about stuff that's like never been right. But more often than not, it just gives you an idea of things that you can work on so that you're addressing those, again, before you're having to do that with someone from the DOL or a lawsuit. Is that good? Yeah. Okay. I have to jot out on a plane to Dallas at about 1:30. But I will leave a few cards with the team, and I'm available if you ever have any questions or need anything to be dealt with. Your 5G team is going to help with a lot of just the low-level compliance issues. If you ever really mess things up, then you might have to call me, right? And that's when I come in with my ERISA counsel hat on. But just keep in mind that we're here to serve. Thank you.
Awesome. That was really good, Beth. Thank you so much. But yeah, I know some of the notices that she talked about. We do have our compliance packet. If you guys do not have that, we have our 5G compliance packet that we do with the chip notices and the HIPAA notices and all the notices she's put on that one slide. If you do not have that, we update that every single year. It provides one clean sweep of all of those notices that you do need to do. And then also we did contract, so Beth works for a company called BCS. You'll start seeing that from us. We just had a huge compliance partnership with them that we secured, so we're going to be the exclusive partner with that firm in Northeast Wisconsin. And Beth's actually going to be doing a lot of those compliance checkups for our clients. So you're going to start seeing that. We're going to start scheduling some of those, and then if it's something, you can feel free to reach out to your service team. All right, so our next to the stage, I would like to invite Matt Ort. Matt has served as an executive leader working for companies such as Toyota Motor Manufacturing and Badger Mining, which won the #1 Great Place to Work in America award. Most recently, Matt served as the VP of HR at Merrill Steel, where he led the company on a 5-year healthcare improvement journey to transform their health plan. In 2018, Matt founded the Healthcare Best Practice Group, which today includes about 1,000 employers and 3,400 free market-minded individuals. In July of 2023, Matt wrote a book called Save Your Company, Don't Feed the Beast, The Employer Healthcare Success Formula, which is helping employers, forward-thinking advisors, physicians, and others who support group health plans find their ways to control costs and maximize quality. In 2022, Matt Ort and John Barron co-founded Self-Fund Health to help brokers and employers be able to write their own healthcare success stories. Please welcome to the stage to share his journey, Matt Ort.
Thanks, Tony. All right. It's great to be here with you. I am from Mosinee, which is south of Wausau, if you know Wisconsin. But I actually lived over here in Freedom for about 9 years. I've been over there about 8 years. I was over here about 9 years, about 20 minutes from here, so I know the valley well. And my background is kind of unique in that I was 25 years with employers, so in human resources. So I saw that this group has a lot of human resources, so I know what that's like. I've lived that for, in fact, most of my career. And my career took an unexpected change when I took the role with Merrill Steel in 2016 as the Vice President of HR. And we took a path where we developed basically a free market model. It's something that's been out there now about 10 to 15 years, and it's really gaining momentum. I would go as far as to say it's the future of healthcare. And I would add this, that Tony and 5G, we've gotten to know them a little bit, and now we're going to be working together. And the fact that I'm here is a testament to 5G, because I can tell you that a lot of the industry still is deeply rooted in the status quo, and I can tell you 5G is not like that. So kudos to that agency for having me here and talking about progressive things and forward-thinking things and things that are truly in the best interest of their clients and not in the interest of, say, the old school insurance agencies. So really excited to share this message with you today. So I find myself really on an unexpected journey. I was in this HR career, right, doing HR, and my passion was always this great place to work, but I took this role with Merrill Steel in 2016, and the owners almost immediately came to me and said, you know, Matt, before you got here, for the last 5 years, our healthcare costs have been going up and up and up. In fact, 9 to 10% per year. This was about a $5.5 million spend. 9 to 10% may not sound that bad when you do the math of $5.5 million. That adds up pretty fast. And so they said, can we do anything about it? We've been absorbing this. We haven't been passing this on to our employees and so forth and their families. And we said, well, let's try. There are I really didn't know what I know today. So I started digging in. And so I'm going to tell that story a little bit Whoops, get the slide here. Okay, there we go. Yeah. So you like my cheese head emoji? I thought that was pretty cool. I can tell you're not that impressed. I thought it was pretty cool. So yeah, just a little about me. I'm really relationship oriented, as you might imagine, with an HR background, but I just believe in taking a few minutes to get to know people. I really like the face-to-face. Virtual's better than phone, but just always try to find the face-to-face. So I think once you establish the relationship, everything just seems to go much easier. But find myself on this unexpected journey after writing the book and releasing it in July of 23. And I don't have any copies here today, but it is on Amazon if you want to check it out. Basically, it's the story of how we did it and what this free market model. I'm now traveling all over the nation. In fact, 17 cities in the first 10 months of this year, so I didn't see that coming. But so I'm going all over the nation and sharing this message, if you will, of how this works. My wife and I are deeply rooted in the community. We are foster parents. I see healthcare as really connected with the community and the community health, right? Overall, financially and physically and so forth. So we've taken in about 30 kids, and we have taken about 6 babies home from the hospital, which is a very interesting experience. And so carrying someone else's baby. And so we're adopting as well. So we have 1 adopted, and then we have 2, we have a 3.5 and a 6-month old as well. So it's not easy, but it's worth it, right? Yeah, so let's jump in. And so, well, I'll cover one more quick thing here. So as we had this success, so as we reduced our plan spend, I'll talk about it in a second at Merrill Steel, by 20% per year, we started getting all these calls. We started winning all these awards, and all these calls of how'd you do it? Well, it's not a fast answer, right? I always joked and said, what are you doing in the next 4 hours? It's not a quick answer. But that's the graph of the healthcare best practice group. And so that's the growth. And you can see even when the book came out in last year, it was only something like 1,200 people and 300 companies. And even since then, it's really exploded. So the best practice has been an approach that I learned way back at Toyota, right? You don't have to create everything from scratch. Use best practices. And essentially what we did was accumulate those and make them into one big strategy. I had a mentor once. I asked him, I said, how can I be successful in my career? This was many years ago. And he said, well, you have to make good decisions. And I said, so how do I make good decisions? He said, well, you have to have lots of experience. I said, well, how do I get experience? He said, well, you have to make a lot of dumb decisions. So I don't know if I can do that. Well, actually, I have done that. Yeah. But there's a couple ways that we can avoid having to make the mistakes and learn from them, right? Mistakes are learning opportunities. One is best practices. One is to have great partners that have done this before. And so we don't always have to make the bad decisions to find a way to win. So I'll touch on this. I'm not going to dig in. This could be probably a day if we wanted it, but really just some highlights of what we did in our health plan transformation. I can tell you that I was in an HR conference yesterday, and it was pretty evident. In fact, a few people vocalized it. They said, I don't like benefits. I'm like, actually, this may sound stupid. I don't either. I never really liked benefits. But what I do like, and I don't need to be a millionaire. I don't need to get rich. My passion is helping people. I would like to get out of debt. That'd be cool. But my passion is helping people. And so this was a great way, with the problem solving I learned at Toyota, this was a great way to help people, right? This is 4th worst in the nation in terms of cost. Most companies are facing this. So that really is my driver, if you go down deep with me, in why I'm doing what I'm doing today. But we found a way. We started building. We were already self-funded. There's lots of misunderstandings about self-funding. If you've ever heard, for instance, we tried self-funding, but it didn't work. And whenever I hear that, it kind of gets me going. I always have to say something, right? Because say, no, it wasn't that's the way you funded your plan, but it wasn't the self-funding it wasn't that failed. It was just that you didn't maybe have a medical strategy. How are you going to reduce your spend? We insure a lot of things. And if we don't reduce our risk and work comp, if we don't practice safety, and we say, well, the way we funded our work comp or something failed. No, it's how about safety? How about we try to be proactive? So that's the free market approach we'll talk about. I would say, one of the things that often isn't as evident is this thing about wisdom, right? So knowledge is knowledge, And what's interesting, when I started this journey and I went to look for books, if you go on Amazon and you look for, right, leadership, you'll get like 500,000 hits or something, right? That topic is out there, and it's a complicated one. When you go and you search something like how to fix employer health care, you find very little. There's a gentleman by the name of John Trinas. He speaks at the conferences I have. I'm having one at the end of August, by the way, if you're interested. Really cool conference. That'll have a national speakers. Charlie Barron's will be there. Miss America will be there. She lives 20 minutes from me. Really cool stuff. But the wisdom part is actually taking the knowledge and putting that into practice. So I think it's more than just a set of tools, right? But when I went to research this, there wasn't really anything out there. John Trinas, who started this maybe back in the early 2000s, he was the only book from an employer who had transformed the health plan. So this is the second book of its kind. There's still really a lack. There's more books coming out, but there's a lack of information. So it's not an easy topic to learn. It's not like, well, I'll just order 5 books and soak it up. It's still maybe that new, even though it really has been around 10 to 15 years now and is gaining momentum. All right. So they're still going today, by the way. So just, how has this worked? Well, you could ask them, but I think they're on their 7th year in a row now of premium, no increases to the premium. Their single rate is about $40 per month. Their family rate is about $160 per month. And they get really great benefits with that, many no-cost options. So that's the kind of, right? So if you've ever seen, I don't know if they made it over here, we were doing Packer commercials and spending a lot of money on advertising and doing healthcare commercials, promoting our clinic and so forth. I don't know if they were statewide. I think there may be more regional. But if you happen to see those, the reason we were doing those was not for healthcare. It was for recruiting, right? So we were using that as a recruiting and retention advantage. I'd go to the chiropractor and he'd say, yeah, there was a Merrill Steel person in here before you. And he said, even if I thought about quitting, I couldn't. The benefits are too great. There's too many of them. There's so many good things. So that really think about benefits more than just benefits, right? It can really be an advantage. In terms of the free market movement, my role, so what I'm doing today is self-fund health. It's a health plan. So we're working with insurance agencies like 5G. We are the health plan modeled after what I did at Merrill Steel and enhanced actually quite a bit since. We now have real-time data. We have active nurses. We see the claims data as it comes in. We can intervene and support patients. It's an actively managed and supported plan, not one you start in January and say, how do we do in December? We're very involved supporting members throughout the process. So that's an option through 5G if you're interested. But so 50% of my time is done supporting employers. That's really my background, right? I'm an employer and employee advocate. The other half, actually, I've been supporting physicians, ironically. I have no medical background, but I support them in terms of how to start a practice or join a practice or to be successful and to do things in the way that we'd all want to shop. A lot of this model is about just open shopping. When we shop for a TV or a restaurant, we know the prices, we know the quality, we make evaluations of whether we go back, and a lot of that's been changed in the healthcare game. So we're just opening that back up and restoring the qualities. Some cool things. So this DPC acronym, so direct primary care. These are doctors that are frustrated within the system. There are a lot of them, of the way that they're forced to practice. These very short primary care visits being used as just a funnel, just to refer to expensive care. It's not very rewarding for the doc who studied half of their life and is not really being able to treat. They just have to refer, prescribe. So a lot of them are frustrated. In 2020, there was an article in the Madison paper that said there were 15 DPCs in the state. I think the first one was 2010. I've traced it back. Today, there's 123 DPCs. That's over 25 new independent clinics per year in terms of this free market movement. DSC, the acronym Direct Specialty Care, just the same. Essentially have buyer and seller working almost directly with each other in these self-funded plans, taking out any of the other middlemen, if you will. This has also popped up in the last many years, new imaging centers, right? When I started at Merrill Steel, we had brought in on-site MRI. Have you seen that truck, that MRI scanner semi that drives around? Well, that was going to the hospitals and clinics. We brought that right to our clinic, and we could get an MRI for $600 But if that same truck picked up its stairs and drove to the hospital, that MRI was $6,000. Same truck. The truck's still making the same. So we just started shopping wisely like we would any other area of the business. We started to treat healthcare like we would any other area. What's interesting, these bullets, these new surgery centers that are popping up, these doctors breaking off, if you just go back 3 years, there's only like 2 bullets on this page. So that's how fast this movement is going. So really, really cool. All right. The Johnson & Johnson plaintiff, by the way, was going to be at my conference. She can't talk about it, but I do know her. She's from Madison. So the book is written in a way, maybe I'm a child at heart. And so we're all really just big kids, right? I am getting older. I tell my kids, as I'm now 50, I was born in the 1900s, so I am getting up there. But the book is written not in textbook form, but there's a lot of humor and really just a way that hopefully makes sense and is fun to read and not this boring thing. So one of the, there's complication here. It's become so complicated that people have gotten lost in the shuffle. But there's kind of 3 ways, like if I had to tell you a really fast answer, there's 3 ways to break it down in terms of how you should do this and working with 5G. So one would be your financial strategy. Look at your finances, know where every dollar is going, and making sure, just like you would any other area of the business, if you're buying products or you're whatever you're doing, you're spending money, you're making sure that money is spent for value. Same thing with healthcare. For some reason, healthcare has been off the radar. The medical, this is mostly lacking in plans today. How are you doing? We're purchasing a healthcare service. It's not some mysterious thing. We're purchasing healthcare services. We should know the price, right? And so we want to reinforce and support all those who are doing that. Excuse me, I'm getting over a cold. So the Don't Feed the Beast, if you've seen the humorous part of the title, by the way, is if someone is not working in a free market way, we just want to, well, just like you would a bad restaurant, maybe you don't go back for now. Now we hope they come to the side. We're not against anyone, but we just want to support those who support transparency and trust and quality and so forth. And so just to clarify that, otherwise I would have called it Fight the Beast. I'm not interested in a fight. I don't have the energy for that. I got kids at home. When I go home, it's a circus. And we just want to support those who are serving us in the right way. And then trustworthy partners. We see these CAA rules, this new CAA that came out about gag clauses and all these things, right? I say, I don't have time to review a 30-page contract for gag clauses. How about I just find partners that don't do stuff that do the right thing when I'm not looking, right? So like, I don't have time for partners that I can't trust and I have to monitor contracts. I'm just dropping all that and I'm finding partners I can trust. Good advisors can help you do that with 5G. So this was a picture, as I mentioned, I'm a child at heart. This was a picture I used way back at Merrill Steel. And I had current as the title, but it's just I found that words didn't work so well. Like nobody wanted to read any great strategy documents or anything, right? But if I put a picture up there, it's like, oh yeah, that makes sense. So this is kind of the current and what we started with of like there's these 1-lane roads and I'd sign, okay, I get 40% discount just to be in a narrow network. And then I'd say, okay, but what's my unit price? What am I actually paying? Oh, there's a gag clause, we can't tell you that. Well, what's 40% then? It might as well be 90%. I need to know what I'm paying. And if I don't like it, my power as a buyer is to go somewhere else. If I go to Best Buy, which it's in the name of the company, right? I want the Best Buy. But if I don't think I'm getting the Best Buy, then I'll go to Sam's or Costco. But at least my power is to say, that's a bad deal, I'm gonna walk away. So we need that option as well as shoppers for healthcare. We can't be trapped into this 1-lane road. And so I had this aha moment. I was supporting the custodial team, mainly because no one else would, honestly, but I cared for this group, and we had about 4 people. And this is simple, the vacuum broke, and we'd repaired it 3 times, and we said, okay, in about 30 minutes, we decided we would buy the exact same one. It was very easy. But I found myself that afternoon filling out a bunch of paperwork, like through the purchasing process, because it wasn't an HR expense, so I couldn't expense it. So, I'm like, okay, we evaluated these 3, here are the prices, da-da-da. And it's just, it's like I agree with this, but I'm busy. And but I realized that morning, that I had signed off on our stop loss. This was before we started kind of our healthcare journey. And all I needed was a nod from the CFO, and it was for $700,000. And then it kind of hit me, and I'm like, wow, I need like all these approvals on a vacuum, but I just signed off, and he said, good. And so I think we need to put healthcare back on the radar. Healthcare is a purchase of services. It's a benefit, but it's a purchase of healthcare services. And so when it's on the radar, we can begin to manage it. Companies already have the skills to manage these things. It just needs to be on the radar. And another quick example, the automotive industry. I love cars. And so if you're maybe a little bit older, you recognize, like when we say the big three, maybe it kind of still is, even though they're not the big three anymore, but right, Ford, GM, and GM has really lost some of their brands, Chrysler. Those were the ones. Like in the 60s, they had like close to 90% of the market share. And so they were working alongside each other, but it wasn't highly competitive. I met this guy named Ken, who was a general manager at Toyota, but back in the day, he was a first-line supervisor managing a pretty hardcore UAW plant for GM, where it was a little rough. He was a big guy. He was a linebacker on his college football team. He wasn't afraid, but he would get himself into some mischief with this union. So his steel desk on the plant floor, they would turn it upside down if he did something they didn't like. I mean, it was pretty kind of physical. They would throw bricks in windshields and things. But he said half the cars coming off the line didn't start. Not because they were junk necessarily, but because they missed a part here, and then I can't put all these other parts on because this part's not on, so they'd throw them in the front seat, and they'd fix them later. But the quality wasn't anything like it is today. Anybody ever gather around the odometer? I'm embarrassed to say we did this, but 100,000 miles, and we're gathering around like we're about to hit 100,000. That was when 100,000 was like an achievement. Now it's like low miles. I'll advertise this car at low miles, right? So quality has really improved. And so in the 80s and the 90s, all these other companies came in. We see there's about 15 of them today. And what they did really, so they started doing lean manufacturing. And when I was at Toyota, the trainer guy, he said, yeah, my Camry's got like 320,000 miles. I think I've only done like tires, batteries, and brakes. Maybe I should get a new one. I'm like, wow. Right? So kind of changing the game of how we look at cars. And today, if we say, was this market effectively disrupted? I would say yes, because it forced the big three at the time, Toyota's now number one, but it forced the big three at the time to improve or lose business. And so we need that. That's the same thing as happening in healthcare with this free market movement. Here's even kind of the famous picture. If anybody would like this, by the way, I'm glad to send you a color copy. It's in the book. But this was the picture I used to describe the strategy, if you will, of what free market healthcare looks like. So in the self-fund health plan, which I mentioned that 5G, if you're interested in learning more about this, bring us in and we'll work with them in helping to implement it. This is an actively managed plan. But you see the dirt road on the left and then the paved road on the right. Now, long term, I think this picture changed. We have hospitals on the left just because of the way they're practicing today. They don't generally share prices. I hope that will change. I actually have hospital executives reach out to me often in confidence to meet, and we talk, presidents and so forth. But I'd really like to bring them over. I'd like to mix this picture together, by the way. But this is, I think, the way it looks today, in that we have hospitals where in our plan, it's by episode of care, so you don't sign up for this right or left. This is all in the plan. It's one plan. If you go to the traditional path, which you can at any time for anything, you just pay your old deductible, co-insurance, and max out of pocket, right? The plan that most still don't understand, let's not pretend everybody even understands that game, right? Nobody understands. Do people understand what co-insurance is? I don't think so, right? But anyway, it's still there in the old way. And then this new side is all of these independent providers I spoke of, this direct primary care. We know 123 scattered throughout Wisconsin. Now we're spreading into Iowa and Minnesota and Illinois and beyond. But we have the state of Wisconsin thoroughly mapped out. And then what we would call DSCs up in the upper right. We have oncology now, even in Green Bay. We have cardiology. We have high-level stuff. So 70 or 80% of the stuff can be shoppable. And so all that is no cost to the member in our plan. So the member gets to choose. They can go left Tuesday, they can go right Wednesday, they can go anywhere they want. And then the direct primary care, if you're not familiar with that, these are these doctors that have broken off. They bring back, they're essentially just restoring to what primary care was maybe 20 or 30 years ago. 30 or 60 minutes, you can reach them outside the meeting. You don't have to wait months to get in. Same or next day. Treatment plans, and not this rushed visit that even the doctors are very frustrated with. And so then they can also help you find this other free care, the $600, the free MRI instead of, and so forth. So that's a short summary of how the plan works, but it's really loved by members. It's sustainable. There's no RBP in it, if you're familiar with that, or if you're not, just know that. I'm not going to get into it, but it's not that. It's really pre-agreed contracts and shopping for value as we do with everything else. So really popular, especially you get into second or third year, you start telling them about premium freezes, right? Premium didn't go up, and that's the first thing they want to know when they walk in those enrollment meetings, right? It's really cool. It starts to become a positive atmosphere instead of that, like they're mad before they sit down atmosphere. I've done that for 20 years. I know how that feels. They started to get excited, and they start to share stories, even maybe a little bit too personal, right? They're like, I had this hernia surgery, and they're standing up in the meeting, and let me tell you about it. I'm like, okay, that's good, but it's like, go for it. I don't care. Go for it. Tell your story, right? If somebody wants to share their personal information, that's fine. But they're excited because the process went really well, and it was also no cost to them. Where can you get a joint replacement that the plan pays $19,000 and you didn't pay a penny, and it's from a hand-picked, high-quality doc where you just spent $100,000 on the other. So it's just really cool to see that excitement build second year, third year, fourth year. I still get messages from Merrill Steel employees that say, hey, did you see this healthcare article? They're like into healthcare now, which is really cool. I think this actually was in Wichita. I was down there in February talking, but just this notion of trustworthy partners, I can't say this enough, right, is I think so often if your mechanic didn't treat you right, you wouldn't be happy, and you would either talk to him or her, or you'd look for a new mechanic if you're a plumber, et cetera. But in healthcare, it just feels like they have gag clauses. It's our data, but they won't share it with us, or it takes 3 months, or just like stuff like that. And we used to have Optum at Merrill Steel, and I don't usually mention names, I'll be careful, but we had them as our PBM, and I'd get off the phone with them, and I'd just be so frustrated. They wouldn't answer my questions. And so, and to each his own, and maybe not everybody maybe it was our rep or whatever, but I was just frustrated, and I said, I need answers to my question. I need someone that I can trust. And so we went out, ended up changing the intro of the book, by the way, if you haven't seen it, is a couple years later, I was actually ran over by a 4,000-pound tractor in my backyard that rolled into the Wisconsin River as I was pulling logs up from the bank, literally right over me. I shouldn't even be here right now. So that whole story's in there. But that really, and I had a bad ER experience and a bad billing experience. Over $20,000 I was being billed for things I didn't even get. And so that really motivated me, kind of wired the way I am. I'm an Iowa farm boy originally. So anyway, this was filmed in Wichita, but is a short video about trust.
Fall, and it'll be an exercise in building trust between one another. So Harrison, if you don't mind going first, step up here on this chair and close your eyes. All right, and then everybody fill in, and we're going to ask you to fall, and then they will catch you. So you have to trust us. I'm going to count to 3, just relax and fall, okay? 1, 2, 3. No, wait, no!
Oops. Yeah. That's one of my favorites. So, all right. And so it's always good to laugh, right? Because some of these things are so serious and life is short. And so I would say, one, if you have good partners like 5G, 2, things are a lot easier. But I can tell you, as I was pioneering so this free market approach now is really catching on nationally, especially, and it's really strong in some states. It kind of originated maybe in Wisconsin and Oklahoma. So there are roots that go back. But sometimes if I had a nickel for every time that someone said that won't work, you'll never do that, I would have quit really early and really fast. So just sometimes it's like, you know what if we want to be innovative? Let's try something new. Let's try something that worked in another state. Let's try this best practice. So this little guy stood out to me. I think so. He's on a basketball team, so it's pretty short. But at one point, someone even yells out, "Where's your team?" So maybe that spirit, if you will, of saying, we're going to do this. We're going to make this right. When I was in HR, I viewed my job as a responsibility to the people that I was leading. I said, I can't just come up here and give you bad news saying nothing we can do about it. I viewed it as, hey, what can I do? This is my job to try to help you. I don't know if I'll succeed, but I'm going to try. So here's the "Where's your team" little clip. So I'd like to see that little guy like 20 years later. He's got to have a fighting spirit, right? Now, there might have been a travel there, just a little bit, but we won't worry about that. They're kids, okay? So yeah, it's been awesome being with you today, and so there's my contact information. The book's out on Amazon if you want to check it out. And then again, if you're interested in the Self-Fund Health Plan, which is modeled after this, which is really we think the future of healthcare, you can reach out to 5G, and then they can help coordinate that. And I'm going to close just with the last page. I'm a bit of an optimist. I believe it's important. The last page of the book talks about the future of healthcare. So I'm just going to share that with you. So it says, the future of American healthcare. The future of healthcare is transparent. The future of healthcare is affordable. The future of healthcare is accessible. The future of healthcare is sustainable. The future of healthcare is understandable. The future of healthcare is relationship-oriented. The future of healthcare is to shop effectively. The future of healthcare is to provide only treatment that is necessary. The future of healthcare is to treat root causes, not just symptoms. The future of healthcare is employers taking fiduciary ownership of their health plans. The future of healthcare doesn't feed the beast, who is oppressive and self-serving. The future of healthcare is a positive sum win-win outcome for all. The future of healthcare is much brighter, and the future of healthcare is in your hands. So thank you for your time today, and please reach out if you're interested.
All right, thanks, Matt. So we have our next speakers before our lunch break here. Next, we have Tia Vaccaro, the lead nurse practitioner for Pivotal Health at their Madison office. Tia has been with Pivotal for 3 years this June. She has also has her with her Courtney Bradley, who is their lead registered nurse at the Madison location, and has been with Pivotal for about a year and a half. Pivotal is one of the direct primary care clinics Matt was talking about and that we work with at 5G Benefits. 5G committed years ago that we would always stay cutting edge and we put a massive investment into Pivotal to get them to Northeast Wisconsin with the goal of lowering the cost of healthcare for you and your employees. Please welcome the Pivotal Health team.
Thank you. I'll let Courtney talk first. And then just the right. This one. Hello, everybody. Welcome. This is awesome. I like to talk, so shut me down if I'm too much, okay? All right. So Pivotal Health. How many, raise your hand, who's heard of Pivotal Health? Okay, most of you. This is great. So I'm just going to give you fill you in a little bit on what we do, who we are, and then we'll go into some details. So we are an urgent care, mobile urgent care, all right? And we come to homes, apartments, dorms, workplaces, wherever you need us, we can come to you. We do our scheduling. We'd like you to use our app, right? That's primarily the way we like to do it. If you don't want to do that, you can call us. But our app, you go in, you put your symptoms in, what time you want to be seen, we'll be there. You don't have to go and sit and wait in urgent care for 4 hours. This is cutting edge, right, guys? Did I just shut it off? Okay, perfect. All right, so like I said, house calls, Primary care, we're starting to do as well. So not only if you have a urgent care need, you need stitches, we can also start to see you as a primary care, you know, your annual wellness visit, etc. We are starting to do that as well. As I said, it's super easy to schedule. We do have a mobile app. If you don't want to do that, you can call us as well. And we expanded our coverage area, so we are now covering Brown, Outagamie, Winnebago, Fond du Lac, Dodge, Calumet, Kewaunee, and Green Lake counties. So we're slowly moving more and more northeast area. And then here's just a few examples of some of the things that we can come see you for. I'm not going to read through this whole list, but we do a lot of flu and COVID RSV testing. We can do anything from seeing rashes. We can see people for certain cases of like asthma, COPD. Obviously, if you're very short of breath and have chest pain, we're going to send you to the ER. But we can do IVs in the home. We can see people for pink eye. I don't know if I said stitches. If you think maybe you broke something, we can come and assess and figure out whether, you know, maybe you have a broken bone, either need some casting in the home, or we'll send you somewhere where you can help with that. STI testing, we can look in your 2-year-old's ears to see if they maybe have an ear infection. Your 82-year-old mother who might have a UTI, we can kind of see it all. And if you're ever, you know, unsure, please call us, and we can always redirect and say yes or no. We can come see you.
So hi guys, I'm Tia. I'm the lead nurse practitioner from Madison. Some of you guys may remember me from last year. I recognize a couple familiar faces. Jack Siebers is next to me. He's one of the nurse practitioners in our Oshkosh and Green Bay offices. So you guys may have met him, or hopefully will meet him in the future with some of your visits. This year I don't have any exciting stories about roosters chasing me or building blanket forts in people's living rooms like I did last year. I have a little bit bigger change for Pivotal. I know a lot of you guys are with health insurance companies, so I might have a couple conversations after this speech here to talk to you about. But as of September 1st, we are no longer going to accept insurance for Pivotal, and we have thought about this decision long and hard, and there's lots of factors that go into it. Really, insurance, being in network with them and offering that to our patients, just ended up having a very high cost burden associated with it. You know, what we go through as far as credentialing our providers to be in network with the insurance companies, you know, working on coding our visits right, especially because we are a home care company. Our coding is very different than like a true clinic setting. Submitting claims has just been challenging at best for the last year or so. We haven't gotten great reimbursement from insurance companies. I'm sure you guys are all aware of that with other healthcare companies. You know, a lot of times insurance companies will deny our claims, so unfortunately we have just been eating a lot of that burden as far when we have been in network with people's insurance companies, and just not getting paid at the end of the day. You know, some days if I'm seeing 10 patients, I can expect like 30 to 40% of those patients to get no reimbursement from. So that was the main driver for this change as of September. So in lieu of not accepting insurance towards the end of the summer, we are now going to do this direct care for employers, which we have been doing with a ton of companies up here in Northeast Wisconsin, and it has been going excellent. So it's an affordable and very convenient alternative for urgent care and primary care, like Courtney was saying. So employers pay a very low monthly cost based on how many employees they have in their company. You can choose to include everybody in your company or exclude some employees that may live outside of our service areas. We can see, again, all of your employees and their family members either at a $0 copay or a very low copay, as high as like $25. This really helps, again, us as the providers bringing care to you, and helps the employees as well, just with no insurance claims. It tends to be better for renewals when they do come, when it comes time. And then our direct care model includes things like health risk assessments. Some of you guys I know are familiar with your employees, annual vaccinations like influenza vaccines, and then obviously any urgent care needs that we would see your clients for as well. So all of the things that Courtney mentioned. Our direct care model also includes a lot of different labs that we have listed that we would make available to you guys. And then if anything your clients needed that was outside of that listed services, we would just offer them our direct pricing for it. So no upcharge that way. You guys would just be paying exactly what it would cost us to run those labs. So pricing, again, kind of just depends on how many employees you guys have. So again, either can pay a little bit higher amount per employee for a $0 copay, otherwise less per employee for a little bit higher cost on that employee model. And we have, I think, I don't know the exact number, but again, a lot of direct employees up here. I know a lot of you guys are shaking your head that are have this type of model with us, and it's been working great. Again, instead of just being able to see the clients, we can see their family members go to their home outside of their work hours. So it's been really excellent that way. A lot of people will ask us questions on, like, how are you different than an on-site clinic? Some of you guys may have had or have on-site clinics at your facilities. So truly, most claims that we see for insurance tend to be for family members and not the actual client or employee that has the insurance. So again, we're able to extend those services to your guys' kids, to your family members outside of those work hours that may not otherwise be able to make it to that on-site clinic during that 9 to 5 business hour. A lot of on-site clinics, again, they're difficult. They're not able to be open after hours, especially during weekends, and we are open evenings and weekends. And those on-site clinics often come with a lot of overhead costs. So we don't have a brick and mortar facility, right? So that gives us a lot more leeway to, again, put financial investment into our care that we're bringing our patients. So a little bit better kind of breakdown. Again, Pivotal, we are open 7 days a week, evenings and weekends. It's never right to Monday morning when people need care. It's that Saturday night when you cut yourself in the garage or something like that. So we can definitely be there for you guys for that. Again, we go to wherever you guys need care. So instead of having to travel into an on-site clinic, we just come to wherever you're booking your appointment at. And again, lower cost for you. Oftentimes, our self-pay fee is much cheaper than going into a traditional urgent care and or emergency room setting. So we have almost 1,000 employees covered with our direct care solution so far at 9 companies and growing in the Green Bay and Fond du Lac area. We've done hundreds of visits in 2023, and that number continues to grow in 2024. So we are so excited to be here. Our booth is right out in front. So again, feel free to stop by and ask us any questions, whether it's in our capabilities or not. And thank you so much for having us here today.
So much. All right. At this time, we're going to go start releasing tables for lunch.